Pterygium is a growth on the external surface of the eye. How does it come? What are the treatment options for this? How to take care of this? Let us see in these videos.
In most cases, a pterygium can be prevented by protecting the eyes from UV radiation and irritation by wearing sunglasses and by using artificial tears to prevent surface dryness. Removal of a pterygium may not be necessary if it does not cause any noticeable symptoms. The growth can sometimes interfere with vision by distorting the cornea, the major focusing lens of the eye. If good vision is threatened, a pterygium can be surgically removed, and with modern surgical techniques, they usually do not recur. A pterygium is an abnormal wedge-shaped growth on the cornea of the eye. This elevated growth is the result of an abnormal process in which the conjunctiva grows onto the cornea. It is not a cancer. The exact reason why pterygia occurs is not completely understood. However, long-term exposure to ultraviolet sunlight and chronic irritation from dry conditions seem to contribute to their development. Pterygia are more common in people that live in tropical environments. Ultraviolet radiation from the sun can sometimes cause an abnormal growth on the surface of the eye called pterygium. This unsightly growth of scar tissue most often originates from the inner cornea of the eye and may continue to grow over the clear front part of the eye called the cornea, affecting the vision. In mild cases, redness and discomfort due to pterygium growth can be controlled by eye drops. However, in some severe cases, pterygium tissue can grow over the cornea to obstruct vision and cause redness and irritation. As a patient, this may hinder your daily life and ability to work. Patients today want to restore their eyes to a naturally white appearance quickly with minimal pain involved. Currently, the only solution or remedy involves surgical removal of the pterygium, a commonly practiced and safe procedure. Once the pterygium is removed, the exposed white part of the eye underneath must be allowed to heal properly. Amniograft is the ideal solution because amniograft has unique biological properties that facilitate faster healing and significantly reduce redness and pain. With amniograft, your vision can be comfortably restored to a natural healing process, so you can get back to the important things in your life. A pterygium is an overgrowth of abnormal scar tissue and blood vessels on the white of the eye and can extend over the cornea, the eye's clear front window. Pterygia grow in response to sunlight. If the pterygium is small, it requires little or no treatment and should be monitored by a healthcare professional. However, surgery is required when the pterygium is distorting your vision, when it's large in size, continues to grow, or is causing recurrent irritation that requires ongoing use of prescribed medications. Surgery might also be considered for cosmetic reasons. The most common surgical technique removes the pterygium and then uses a portion of your conjunctiva, the membrane that covers the white of the eye, to fill the empty space. This procedure usually takes less than 30 minutes under local anesthetic. You may experience some discomfort and double vision once the anesthesia wears off. Be sure to arrange for someone to drive you home, as your eye may be sore. You will usually be prescribed eye drops to ease any discomfort and decrease inflammation. You may also need to wear an eye patch for a couple of days to protect your eye as it heals. Usually, you can return to normal activities after a few days. But avoid strenuous activity, swimming, and rubbing your eyes until it heals. Attending follow-up appointments with your eye care professionals is essential to ensure proper healing and visual recovery. Ultimately, recovery varies from person to person. Ask us if you have any questions about pterygium surgery.